The growing rate of malnutrition among children in northeast Nigeria, particularly in Borno and Yobe states, is raising serious health concern, with experts warning of its devastating impact on child survival. In Borno and Yobe states, cases of child malnutrition are becoming increasingly alarming, contributing to a surge in illness and vulnerability among children in the region. Many stakeholders attributed the widening nutritional gap to persistent insecurity, which has disrupted livelihoods, limited access to food, and displaced thousands of families. According to United Nations Children's Fund (UNICEF), Nigeria accounts for one of the highest burden of malnourished children globally. In Northeast alone, millions of children are in urgent need of nutritional support, with severe acute malnutrition posing a significant threat to child survival if not promptly addressed. Mothers and caregivers often face emotional and psychological strain while managing malnourished children, with many expressing distress over limited resources and access to care. One of such caregivers is Hawa Isa, a resident of Damaturu in Yobe State, who is currently caring for 8-month-old Abubakar, a child who lost his mother during childbirth. Hawa narrated her ordeal, explaining that the infant has been battling acute malnutrition. She noted that upon visiting a health facility, the child was enrolled in a nutrition program and placed on ready-to-use therapeutic food, which has helped improve his condition.
Baya cin abinci, zawayi, amai, uwar da ta rasu ta bashi, yana ɗauko shi. To tukunan rasuwa ta yi uwar, wata ce 8 uwar ta rasu, na kawo shi. Ita rashin lafiya amma da ake ba mu tamuwa sai ya samu sauki. Yanzu a hannuna, yanzu bayan wannan watan da muke ciki, in ya mutu shekaran shi ɗaya a hannuna.
A nutrition officer at the facility emphasized the importance of early detection and treatment of malnutrition, noting that interventions such as RUTF, proper infant feeding practices, and community awareness are critical in reducing child mortality.
Malnutrition is a great burden in Yobe State because ever since 2016, the GAM rate in Yobe State, as the global acute malnutrition rate in Yobe State, has been at a serious level. It has been around 14% till in 2022, when it dropped down to 8%. And then there was a high surge of there was a surge in malnutrition around 2023 to date. Despite the fact that we are recording some certain improvements, but that improvement isn't enough to shift us from the phase we are before. We've been in phase 3, that's the IPC acute malnutrition phase of phase 3, which is known as the serious level. But the figures is decreasing, and we are currently at 10.9%, that's still the serious level. But gradually, we believe that by the end of this year, we might likely move or shift to phase 2 because of the interventions we are receiving.
As humanitarian challenges persist in Borno and Yobe states, stakeholders continue to call for strengthened interventions, improve access to healthcare, and sustained support for vulnerable families to cope the rising burden of child malnutrition across the northeast. Solomon Josiah, TV360, Borno.